Hello and welcome to our channel. This is from Geriatric Medicine Department, Medical College and Hospital, Kolkata, and today we are going to discuss a very important topic regarding geriatric population, that is geriatric vaccination. And this is an unfortunate fact that although there is a rampant success in our immunization schedule, particularly for pediatric age group, and post-COVID there is a consciousness that COVID vaccines can be also given to adult and elderly people, but there is no particular consensus that whether elderly people should receive some vaccination or not. And this is probably due to the lack of awareness of this geriatric vaccination, due to lack of geriatrician particularly. In this short video, we are going to discuss why geriatric vaccination is so important, and second, what should we receive as a geriatric age group. First, as you know, the children and the elderly person particularly have the similarity in immune system because both are compromised or they have poor immune regulation system. That's why they need vaccination. But unfortunately, particularly in India, we give importance to our child at home, but at the same home we have our elderly people whom we ignore consciously or unconsciously. That's why this video gives you a clarity why you should and what you should give your elderly as a vaccination. First, contact your local health system, and some hospitals have this facility to provide, but due to lack of awareness from government also, there is no proper supply of these vaccines all throughout the year. And then contact your doctor who treats your elderly person in home so that they can receive this vaccine. In this video, we are going to discuss three particular vaccines. Number one, pneumococcal vaccine. Number two, influenza vaccine. And number three, herpes zoster vaccine. Along with, we'll also discuss a little bit on Tdap, that is tetanus, diphtheria and pertussis. The first two are most important because it is seen that almost 30% of the 60 plus people, they are affected by this influenza or pneumococcus in any time of their lifespan, and most of them are either hospitalized or die due to the complication of this disease progress. So if these diseases can be reduced, their severity can be reduced or their prevalence can be reduced, then it is a very important step in our health system because the disease burden will be reduced. And due to the progress of health science, there are vaccines against these particular two diseases, pneumococcal related pneumonia and influenza related pneumonia. And for influenza, it is recommended throughout the world that at age 65 or above should receive this vaccine once in a year throughout their lifespan. So any person having age 65 or above can get this vaccine annually, particularly during the season change, that is in our northern region, northern global region, during October, November. This annual vaccination is important because it is seen that this influenza actually changes their strains every year. That's why it is important to give a booster dose or give second dose every year. Second vaccine is pneumococcal vaccine. For this, there are multiple options, but in our India, it is recommended that any person having 50 or above should receive PCV 13 first, followed by PPSV 23 1 year later. And there is another vaccine that is coming against this pneumococcal, that is PCV 20. Once you get this, there is no need of second vaccination. And if anyone has received this 2 doses of PCV 13 and PPSV 23 or PCV 20 as such, they will not be usually required to have another vaccination. They will be immune throughout their life. But for some particular complicated cases, those who have a lower respiratory tract illness like COPD, asthma, or having heart disease or any comorbidities that can actually worsen their lifestyle, in those cases, in those particular cases, by the recommendation of your doctor, your senior citizen can receive second dose 5 years later. Coming to the third vaccine, that is herpes zoster vaccine. This is not recommended for every people because it is quite costly. So coming to the cost of the first two vaccines, although this can be supplied from government sector, but there is no actually a continuous supply. That's why some people can also take these vaccines from private sector, and the cost is approximately for influenza is 1200 to 1500 annually, and for influenza PCV 13 usually costs around 3000 to 3500, and PPSV 23 usually costs around 2000 to 2500, and PCV 20 that is given once in your lifespan that costs approximately 4000 to 5000. So definitely ask your doctor first whether you can get this from government facilities. If it is okay, then definitely go to the hospital and receive this vaccine, and if not, then get it from your doctor and his or her recommendation. The third vaccine that is quite expensive, it is Shingrix vaccine, and it is given to reduce the complication of herpes zoster that can be life-threatening condition. And this is the same virus that causes chickenpox in our childhood, but in elderly, when it gets reactivated, it can worsen the condition and even cause death. That's why it is also recommended to receive this Shingrix vaccine. It is given in 2 doses, 8 weeks apart, and each dose approximately costs 10,000 to 11,000. So it is an optional choice, but if your elderly people has some comorbidities, ask your doctor. If he or she recommends, then definitely he or your elderly person should receive this vaccine. Coming to the last one, that is Tdap, tetanus, diphtheria, and pertussis. Although it is given in our childhood, but due to aging process, this vaccine actually is reduced by its property. That's why it is also recommended to have this vaccination, and this is not only to immunize your elderly person, but also to protect your children who might not be immunized till date. That's why the importance of this vaccine. So first two, that is pneumococcal and influenza, these are the most important vaccines. Definitely ask your doctor, go to the hospital and vaccinate your elderly people whom you actually love. Thank you.